So it's nice to see a full hall at the lunchtime, and I hope my cases are interesting to keep all of you here. So I'll be presenting a few cases of challenging keratitis. This is the first case of a 56-year-old female who presented to us with pain, redness and watering with a 2 months history and also diminution of vision since 2 months. This was her picture when she presented to us. The AC was full of exudates, though the surface did not look very bad. And she was referred to us for, this is her picture in high magnification, the AC was full of exudates, and she was referred to us for a planned therapeutic keratoplasty. When she presented to us, she was on fortified antibiotics as well as systemic antibiotics. She had also had a course of systemic as well as topical antifungals. At her presentation, even we were not very sure as to what it is. An AC wash was done and the sample was sent for a microscopy, which gave us few gram-positive cocci and nothing definitive. So at this point, we were thinking, was it really a microbial keratitis? This is the picture of her other eye. If you see, it is a corneal scar with a immature senile cataract and a vision of 660. So is it something that we missed out on our evaluation? The patient has had similar episodes in the past, and also her fellow eye is a vascularized scar. She, having such an angry looking ulcer, she is not really very symptomatic. She opens her eyes well for photographs and for evaluation. There is no sloughing on the ulcer like you would see in any microbial keratitis. And also the ulcer did show presence of vessels in the periphery, and she had absent sensations. So at this point, we diagnosed her as a viral necrotizing stromal keratitis, and she was put on treatment for the same, which included systemic as well as topical fluid and lubricants, excessive lubricants. And yes, after 5 days, she shows signs of healing. There is a very small infiltrate that is remaining and an epithelial defect. After 10 days, these are her pictures. At 2 weeks, the epithelial defect had healed, but yes, there was a lot of edema. At this point, she was put on topical steroids, and at 4 weeks, she finally healed with a scar. So, to discuss the management protocol for the herpetic diseases, the HEDS study did not give really a very good. They did say that the topical corticosteroid regimen used in HEDS was significantly better than the placebo in reducing the persistence of disease, and also it shortened the duration of stromal keratitis. But then they also did not give any statistically or clinically significant benefit in the use of systemic acyclovir along with topical corticosteroids. So if you go back and see how did they define stromal keratitis, it was defined as an area of at least 2.5 millimeters square of active stromal corneal infiltration. But here, if you see their eligibility criteria, they said that it was the eligibility criteria was no epithelial defect larger than 1 mm of the involved eye. So if you see these actual cases that they studied, which did respond to topical steroids but did not show a benefit of oral acyclovir, were probably endothelitis and not stromal disease. This is another of our cases which was a similar with an epithelial defect and an infiltrate treated on the lines of herpetic stromal disease. And we have always added topical steroids after an initial course of systemic acyclovir was given. And finally heals at 10 weeks. So if you go to see in the classification of herpetic disease, the diseases that present with a live replicating virus are a dendritic ulcer, wherein there is a definite benefit of topical antiviral and no additional benefit of oral acyclovir. Also, a necrotizing stromal keratitis, HEDS did not really comment on this entity, though if you see clinically, oral acyclovir has definitely shown a benefit. In uveitis, they also again have shown a non-statistical benefit of trend of oral acyclovir in trabeculitis. So we did a study at SHROFF wherein we had 13 patients who were given a oral course of oral acyclovir 5 times a day, and followed by which they were started on diluted topical steroids, and most of these cases were proven viral. So in the PCR proven viral, so we concluded that topical and systemic acyclovir for the treatment of for necrotizing stromal keratitis does facilitate the healing of ulceration. And topical steroids after an initial antiviral therapy are definitely safe and improve the visual recovery. These are few of our cases that were included in it. So stromal necrotizing keratitis is a distinct entity and responds to systemic and topical acyclovir. These are cases that were included in our study. This is a case that at presentation had an infiltrate of 6 mm squared, and on regular follow-ups it shows that at 2 weeks and 5 weeks the size of the infiltrate has reduced and finally has healed with a scar. This is the final follow-up picture of the same. So this is another case which I would be showing you of. It presents with a typical geographic ulcer, put on topical acyclovir and shows healing. Finally, it seems to have healed but not really. If you see, there's a small epithelial defect which has a neurotrophic kind of an appearance, and a tarsorrhaphy was done which healed the epithelial defect, but then again a stromal disease recurred in the same eye. So if you see the trends of HSV recurrence, it is 9.6% at 1 year, 22% at 2 years, 36% at 5 years, and 63% at 20 years. So another case which shows a herpetic recurrence on a graft. You can see a typical geographic ulcer which has presented on a graft, and it is on either side of the graft host junction. This was a patient post keratoplasty which was done 2 months back after a quiescent period in that eye, the patient being one-eyed, and now he has presented with a geographic ulcer. He was on treatment following keratoplasty on acyclovir prophylaxis, though was non-compliant to the same. So this is how the patient was put on aggressive antiviral treatment, and he finally healed with a scar. So ocular herpes is at least 6 times more prevalent after corneal transplant surgery. And even if you see, there is a 21 to 39% rate of recurrence in keratoplasty without prophylaxis. Though with prophylaxis, this rate of recurrence has been reduced to nearly 7.4%. But how long the duration of prophylaxis is something that is still, the results of that study are still awaited. So with this, I would like to end my presentation and would invite any questions.